Modifiers and level 2 Hcpcs. So Linda writes, can you please cover the determining fact between using modifiers 22, 23, 24, 25, etc., and the level 2 Hcpcs codes? Is it the ones that go on E&M level and the others on the procedure codes? Thanks, Linda. That's, obviously a big, huge topic. I do have a modifiers class on demand that's available on the website. We also have, as many people have taken advantage of, the modifier grid that I'm about to show you. And this you can get from the site. I'll show you where to get that from. If you go to free coding tools and downloads, you'll see the CPT modifier decision grid tool. You just pop in your name and email and you'll be able to download it. It's a PDF and it'll look like this. What I did with this grid and this presentation that goes along with it is I explain modifiers by family versus in numerical order. So first of all, on the slide, modifier 22 is gone. That doesn't exist anymore. But if you look at it this way, that will really help you know when you need to append modifiers in what situation. So I just wanted to briefly go over this. The families or the groups of modifiers that I've identified, maybe you can see different families, are the big one, the global package modifier family. If a patient's had a surgery and they're in a global period, your typical major surgery has a 90-day global period. Some other payers other than Medicare actually even have a 120-day global period. And what that means is during that time after the surgery, when they come in for their routine follow-up, that physician's office cannot bill an E&M because it's been bundled into the fee they got for the surgery. Okay? So, but sometimes there's exceptions. Maybe they're in the global period, but they're coming in for another reason. And that's what this whole first section of the global package modifiers on this grid is talking about. 24, if it's an unrelated E&M service by the same physician that did the surgery, you would use 24 on your E&M. If it was the day that they decided to do the surgery, you're allowed to get paid for that. You don't get paid for the pre-op visit. So 57 helps tell the payer, look, I know this is on the same claim as the surgery and you're going to think it's pre-op and you're going to bundle it in and not pay it. I'm putting 57 on to tell you that this is not the pre-op visit, so pay it, okay? 58 is the staged or related procedure. So they've the one that always comes to mind is cleft palate repair. It's very unlikely that they're going to be able to do the whole entire surgery in one operative session. So they know maybe in 45 days or 6 weeks, they're going to do stage 2 of the procedure. Because that's within the 90 days of the first procedure, they would need to use 58 on the second one to say that it's the second stage. Now the global period will reset from the date of the second surgery. 76, repeat procedure. 77, repeat by another physician. 78, return to the OR for a related one. 79, unrelated procedure. So maybe they had hip surgery and they fell and broke the other hip. So it's unrelated to the first one, but they're being seen by the same specialist. So they would use 79. So you get the idea. Understand it by family, and that will help you know when you need to even consider modifiers at all. If they're not in the global period, then you can just skip over this whole group that we just did. Then we have bundling or CCI modifiers. We did on a previous webinar a segment on CCI, so you might want to go back and look for that. That's correct coding initiative. In a nutshell, they give us pairs of codes and let us know that these two codes should not be billed together because they consider one bundled into the other. But there are exceptions to that. So that's where some of these modifiers come in, especially 59. One of this Linda had asked about 59 specifically, and I had answered it on the discussion board, is 59 has to do with bundling. If the two codes, I think her specific question was for intramuscular injections. If they did 2 intramuscular injections, should you put 59 on the second one? And the answer, I felt was no, because if you see 2 separate injections, you wouldn't expect them to be bundled into each other. So 59 is to say, I know these are normally bundled, but in this case, they shouldn't be bundled. So an example that I use for that is a patient having an oophorectomy, emergent. They're going in to remove the ovary, and then they close them up, and then a few hours later, something is going wrong. They got to go back in and open them up and do an exploratory lap to see what's going on. Now, the laparotomy is bundled into the oophorectomy, but because they did a second one later on, that one they can bill for. So they have to put 59 on it, because otherwise the payer is going to bundle it in and say, nope, that's, that hits a CCI edit. So you'd put 59 on the laparotomy to say that this is a distinct procedural service from the other one I'm normally bundled into. Let's see. Then we've got E&M only ones. Those are pretty self-explanatory. We've got number of surgeon modifiers. So I think you can kind of read that and get the idea. So anyway, I just wanted to, draw your attention to this modifier grid. It's a free download. The class that goes along with it, the on-demand class, is, I think one of my very first works I did, and I presented that at the AAPC conference for several years in a row, and I get asked to do that at a lot of local chapters. So hopefully you will enjoy that.
And it's free.
And it's free. Oh, and I'll just give you an idea of how I teach you to mark up your Appendix A. And Ruth brought this out on the forums as well, that this is where they actually live, okay? There is a shortened list on the inside cover of CPT, but this is where Appendix A is where the modifier descriptions live. Did I say modifier 22 is gone? I meant 21. I just realized I had said that. And so what I do is I took my grid and I would do my arrows. If an arrow is going up and to the right, it means that, without the modifier, it probably wouldn't get considered for payment. If the arrow goes down, then I'm expecting the fee to go down, because the name of the presentation is Modifiers. It's all about the money. If you think about how appending that modifier to the code will affect the reimbursement of it, that will help you realize when you need to use it or not. So at any rate, you'll get a copy of this if you do that on-demand class as well.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.